Hello and welcome to another episode of the Align and Elevated podcast. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Community and Coaching, and the host of this podcast. Okay, so today what we are going to dive into is postpartum. So everybody's heard it now. Once postpartum, always postpartum. It's as old as day, but like once you've had a kid, you can't unhave a kid. Okay, your body changes permanently. There are many things that happen in the birth process and in the accumulation of the 9 to 10 months that you're pregnant that your body changes. And then we go and deliver this baby, and then we're set on to recover and go live our normal lives. Well, when push comes to shove, we hopefully all know now, it's become a lot more mainstream. I released my book in 2020, and it is Restore Your Body After Kids, the secret to avoid peeing your pants and achy joints as you age. Since then, really like TikTok, social medias, they've blown up with like everything to do postpartum to restore your body after having kids. And the reality is, and I want to make this very clear. Once you have children and your body's gone through that process, yes, we restore our bodies afterwards. Everyone should have pelvic floor physical therapy. Get your pelvic floor super strong, help your pelvis come back together, help your core function, help your joints move, help your glutes move so that they can contract and that they can support your pelvic floor and therefore support your joints and support your bladder and support your pelvic organs. But like, I think the somewhat depressing news is like, you have to keep up supporting your body through the entirety of life. Yes, you have kids. Yes, you need to restore your body. And also this restoration continues. Childbirth is massive, massive. And also just getting old without childbirth is significant on our body, right? Like we just don't recover as fast. We're not having we might not feel as supple in our joints. We have to work on that stuff a lot more than when we were just kids. For a lot of people. Now, some people are genetic phenomenons and they can go and have like phenomenal mobility without working on it and might have some underlying hypermobility, but I totally digress here. The deal is, and it's kind of depressing, especially as I'm talking to like some of my friends, like we're turning, like I'm 39, I just turned 39, I'm going to be 40 this coming year. A lot of my friends are in their 40s now, and like, yes, we feel old, and like we're fairly healthy, like trying to do things to make our bodies feel healthy. And I don't want to say we feel old, but a lot of people are now starting to talk about their aches and pains, myself being one of them. I'm like, I trained so hard, but yeah, I'm still dealing with this back injury, and now my knee is talking to me, and it's frustrating because you're like, I'm doing everything to like get this body going, and all of a sudden you feel that frustration of being like, I've done everything. I've done pelvic floor physical therapy. I'm doing everything, and my body is still talking to me in different places. And so that's where we're gonna go. The reason I want to talk about this today is because I've had some friends texting me and being like, I'm doing everything and my hip still hurts, or my back is hurting, or it came back after like being pain-free for 3 months. And like, the deal is like, we just have to keep ourselves tuned up. Like, there is no simple way to do it. Like, we all develop patterns by the time we're 40. Maybe we've been walking weird since that one ankle sprain 20 years ago, or you've been compensating since your knee surgery when you were a teenager, or you've been compensating since you had babies and now they're teenagers. And so our bodies just talk to us. They keep the score. There's a book that's like, Our Bodies Keep the Score, and they really do, right? So what we have to do, what our responsibility is like, just keep progressing. And that's where I think like, when you go for optimal living, optimal health, optimal wellness, optimal recovery, optimal strength, when you start to be like, I'm not going to just be your average Joe Schmo, and I'm going to actually like work on my fitness, I'm going to work on my health, what you start to do and what you start to achieve is more so of a also recovery process. It's equally a recovery process, because if you're not doing that stuff, if you're not striving for optimal health, you are kind of going to live in that sickness zone anyways. And so you're going to be trying to pull yourself out of there. And the reality is, when you're pulling yourself out of sickness and injury, when you're pulling yourself out of childbirth and postpartum, when you're pulling yourself into optimal physical performance, optimal human condition, optimal human strength, and you're like shooting for optimal health, the process in which you achieve those recoveries or shoot for the optimal is really all one and the same, right? We can do Shockwave for ultimate health, and we can do Shockwave for injury recovery. We can do EMTT for muscle recovery and performance. We can do EMTT for inflammation after an acute joint sprain or after a surgery. We can do pelvic floor physical therapy for optimal glute activation, optimal muscle building, optimal sports performance, optimal sprinting. We can do pelvic floor physical therapy for back pain recovery, for hip pain recovery, for sciatica recovery. So the deal is, like, the tools in which we are tapping into in order to help us achieve that optimal health, that optimal performance, and the tools which we're striving to use in order to keep that back pain at bay, to keep that knee pain at bay, to keep that ankle pain at bay, are really the same exact tools that we're using for optimal health and optimal performance. So why am I talking about this? Because if you weren't doing one, you're doing the other. Like, that's the deal. And if you're doing, if you're chasing this knee pain, you might think, oh, well, I just need a knee surgery. Okay, but the minute you get that next knee surgery, your body's going to compensate again. Things are not going to articulate and move the way they used to. So you're still going to be in the game of continued recovery. Yes, it's going to be more intense that, 6 months post-surgery, 1 year post-surgery, but it's going to linger forever, right? Like, you're always going to have to be doing those 1 or 2 stretches to help make sure you have your knee mobility, or make sure you have your proprioception and ability to stand in that joint. It's all one and the same. And I can't state that enough, because it's just really important, especially as we have these expectations of ourselves, like, okay, I'm going to live 100% pain-free. I'm not perfect until I'm 100% pain-free. And like, yes, I'm in that, like, do I sometimes feel like a freaking fraud because I've been having this back pain and I'm like, how come I can, like, literally cure everybody else's back pain, but I can't cure my own? It's not about that. Like, even though I'm helping people fix their back pain or helping people fix their pelvic floor or their SI joint pain, like, they still have to maintain those gains. And if we slip into our old patterns, that pain's going to come right back. So that's where it's like, you still have to work on it. And I love to push my body. I love to push my training. I love to push playing hockey. I want to continue to be as active as possible. And so I have to do these things for optimal health and optimal performance. And in the same vein, they're the exact same things that I'm doing to recover from the back pain, to recover from the pelvic floor leakage, to recover, so my prolapse, right? I've talked about that many times on this podcast before. I have a pelvic organ prolapse, and I haven't had any symptoms of that for probably over a year, just because of all the recovery I've been doing. The deal is, once you've had kids, once you've had the injury, as we're getting older, you just have to keep up the basics. And so let's dive into, like, a little bit about what I think the basics are and what they've been for me and my body. Now, there's about 1 million different methodologies out there. So you can go follow people with 1 million followers and 2 million followers. And sure, like, maybe you get some good takeaways. Maybe you can implement it into your life. But what I am telling you is based on our clinical outcomes. And so this is what we see on real life people every single day. And it's actually being done in my clinic. And so I'm not giving you, like, the TikTok sensations, but really, truly, like, full on optimal health and wellness, AKA postpartum recovery, AKA sciatica recovery, back pain recovery, all the recoveries, all one and the freaking same, okay? So this is what I've been doing. This is what people in my clinic have been doing, and we've been seeing amazing outcomes and really feeling good in our energy, feeling good in pain-free zones, feeling like we can really do anything in life and not be bogged down by restrictive, like, oh, I can't bend over and get that, or I can't carry my kid, yada, yada, yada. So, and this is completely biased, right? Like, but this is what we see in the clinic. It's like when you do pelvic floor physical therapy, your hips move better. You poop and pee a shit ton better. You have better sex. You have better mobility in general. You can squat better. You can deadlift better. You can do better pull-ups. Like in general, your body is going to move so much better when you have really good pelvic floor health. And so doing pelvic floor physical therapy to me is an absolute non-negotiable. Now, I think everybody, once you get to a good baseline and you have a healthy pelvic floor, doing, pelvic floor work once a month is an amazing tune-up. Now, can you do it once a week? Absolutely. Should you? Absolutely. If you can, you should. Because if you're dedicated to your health and wellness, doing that alone will prevent you a hip replacement. That alone will prevent you a knee replacement. Now, barring any traumatic car accident or trauma injury, right? That's really where surgeries come into play. But doing pelvic floor physical therapy has so many benefits that are just understated, and you don't just do a course of pelvic floor physical therapy for 6, 8, 12 weeks and then you're cured. You really got to keep it up. And that's where I'm the maintenance part of it, continuing to reinvest in your body, is so essential, because you make sure that the tissue stays healthy, dynamic, strong, and mobile. And when you have that, then you're not going to have the back pain, you're not going to have the hip pain, you're not going to have the bladder incontinence. You're going to have just a stronger baseline, a stronger core overall, and so you're going to feel a lot better in your body. So to me, as we get older as women, pelvic floor physical therapy, and we're not talking Kegels, and we're not talking hooking somebody up to biofeedback. We're talking about true pelvic therapy where you are manipulating the tissue, really improving the vascularity of the tissue. You're improving the strength of the tissue because you're developing eccentric elongation capacity. You are improving the texture of the muscle, the quality of the muscle, the integrity of the muscle. If you just continually work a really, really tight muscle, eventually the bicep's going to get weak and fibrotic because it's just constantly kind of contracted. You really have to, if you want to make strength gains and have a functioning bicep, you have to work on all phases and range of motion of the muscle. And the same goes for the pelvic floor. But with women, our pelvic floors tend to just be tightened. And it's funny that all the marketing around pelvic floor health is still using the Emsella chair, getting contractions. Oh, this does 700 Kegels a day. Have you not gotten the freaking message that we don't need to be doing more Kegels? Has that not come across? Because what I see is that actually hurts people. So let's give them the ability to open their pelvic floor, the ability to eccentric elongate their pelvic floor so that they can have contraction. Let's give them the ability to eccentrically elongate their pelvic floor so they can activate their lower transverse abdominis muscle. When you have such a tightened pelvic floor, you have so much intra-abdominal pressure. So then to think that you are going to be contracting your abdominals against that intra-abdominal pressure is, unrealistic to think that your abdominals are going to be strong when you have that tight of a pelvic floor. It's just not, it's not functional. It's not going to help you have strong hips. It's not going to help you have a strong back. And so those are the things that I still get baffled that, that's marketed. Now go through a course of, maybe you have nerve injury and maybe that's when it's a good thing for, if you have good eccentric elongation, but you can't pick up the muscle, which is very rare, then yes, maybe some kind of stim unit is good for you. Maybe some kind of biofeedback is good for you, but I just don't see that in our practice at all for when we're talking women, 28 to 58. That's just not part of this demographic, truly. Now, are there outliers? Absolutely. But for the most part, most people are stuck in some kind of contraction pattern and have some kind of adhesions that are blocking the ability to get a full contraction and full relaxation, which is limiting the ability for the pelvic floor to be strong and to do its job. So I hands down believe that pelvic floor physical therapy is a non-negotiable. Now, so that's a once a month deal. I also think doing some mobility every single day on yourself, some stretching, some foam rolling, maybe some lacrosse balls, That's also my non-negotiable, even if it's just 5 minutes a day. Like, get on the floor, do some cobras, do some spinal extensions, just to help open up your spine in a direction that it's not used to going, open up your hip joints, open up your pelvis, just so you can, put your body in different positions that you don't really sustain during the day that can have and hold a lot of tension. So even just 5 minutes of mobility a day is helpful. Now, is 20? Yes. Is 40? Yes. And now, since I've been going through my back injury, like, I have to do 40 minutes of mobility minimum every single day in order to get out of bed, in order to hit the workouts I want to hit. So that's my non-negotiable. Those are what I have to do anyways. But what I'm telling you from like a health optimal position, or even just like postpartum, it's like, do 5 minutes of mobility exercises, whether it's, bust out 10 cobras, do a couple down dogs, do some hip opener muscles, maybe a pigeon pose on each side and a psoas stretch on each side, and just get the body flowing and moving in those directions, because that will help you maintain injury prevention and also help you with your optimal performance. Now, I also think that strength has to be a non-negotiable. Now, when I say strength, I mean total body strength. And your core is active during all total body strength. So I love strength training 4 to 5 days a week. Now, you might only be able to do 2 to 3, but as long as you're getting under some kind of weighted exercise, 2 to 3 times a week, that is good. I don't know the current data on osteoporosis. Yeah, so I think the current osteoporosis recommendation, so for preventing osteoporosis, is absolutely lifting at least 2 days a week with a minimum of 30 minutes, but really that's going to vary based on each person. So, lift weights when you can. So that, we have pelvic floor physical therapy, we have mobility, we have strength training at least 2 days a week. And then I absolutely love Pilates. And I think Pilates is one of the best exercise, but it depends how you perform it, right? Like, same with strength training. Like, you could go in and it not really be effective because you're just like flopping your arm around, right? Like, you see people at the gym do that just because they haven't been taught appropriately. And so that's where I do think it's important. Like, go study some good YouTube videos. It's all free. Like, we have it on our channel too. We can even link some of our strength training videos to this episode. But like, go study body mechanics so you can actually feel the muscles contracting, because you can do something willy-nilly like some bicep curls, and if you don't feel the bicep, then it's not effective. You could do squats, but if you don't feel your muscles, then it's not effective. Or if you're having pain and you feel blocked, then it's not going to be effective for you. So go study mechanics of that, or get a personal trainer, and that can help you be more confident with your strength training. Or there's strength training classes, right? Like at any gym. So, those are some non-negotiables, but then I digress. Like, I absolutely love Pilates. I've tried the Club Pilates in Linwood, so we can take them. I love going to Woodway Wellness. It's probably my favorite because it is so small. They have like 4 reformers, so each class is a max of 4 people, and you just get that one-on-one attention. I tend to breathe really loud and like actively manage my intra-abdominal pressure. And so, and they're just totally open to it. They don't care that they can hear you breathing, and like, it's awesome. And they encourage it, actually. So I love going to Woodway Wellness. Maybe I can get Carla, the owner of Woodway Wellness, on the podcast soon. But I highly recommend checking out a Pilates studio that works for you. LA Fitness also just got Pilates, Reformer Pilates. Yeah, so you could check them out too. Now, I will tell you that I prefer Reformer Pilates versus mat Pilates. For me, my body just does not love mat Pilates. I can't progress my core very far at all past like any basic exercise. And also, when I was in grad school, I got like a hip bursitis from laying on my side just on the mat during Pilates, and it was just so I don't love mat Pilates, but I know some people do, and I'm sure like I could take a class again and modify for myself. But I do recommend for Reformer Pilates. I think it's one of the best things. I like to try to go once a week. Is that happening? No, but at least once a month, yes. So, just do it when you can, absolutely. So those are kind of like my non-negotiables. Now I will say, like, if you want a strength training class, like, you could always check out Bar 3. Those are great strength training classes as well that also get some of the core. There are other like individual trainers in the area that that do strength training for women specifically, and classes, and so check them out. If you want one-on-one training, Mora from Bodies for Birth, she does one-on-one training for women through all phases of life, menopause, pregnancy, postpartum. So I really like Bodies for Birth. She is a complete and utter expert. So she will give you a really solid program, or also just like train you through it so she can look at your mechanics and all that good stuff. And I know she does some work virtually. So there's a lot of people that we can tag at the end of this to be able to help you like do the strength training, do the Pilates. It's just, those are the non-essentials. But if you can't do them and you're not in the phase of life, maybe you are just chaos, 2 kids under 2, kids are 3 and 5 even, and you just haven't gotten your balance back. What becomes the non-negotiable when fitness falls off the table, when strength training falls off the table, when mobility falls off the table? The non-negotiable to just function then is pelvic floor physical therapy. So you use pelvic floor physical therapy as health optimization when you're doing all the strength, you're doing the Pilates. You use pelvic floor physical therapy when you can't do anything and you're living that couch potato life / chaotic mom life / everything is a fire. Like, you just want your kids to wake up and have a good day, and then also you're just counting the hours until bedtime. Like, you use pelvic floor physical therapy then, because when you can't take care of yourself, at least pelvic floor physical therapy can take care of you, and it will help you function so much better without wearing your body out even more. And then also, in the same vein, you use pelvic floor physical therapy once you do get a good routine. Maybe it takes you 5 to 6, 7 years to get out of that chaos. It did me. Okay, I barely exercise. I exercise, but nothing, serious. I would say once Kano, my second, was born in 2017 to 2021, like, it was like I was growing the business, I was in the thralls of mom life, and I just couldn't get myself to get like consistent enough with any routine. So it was kind of like just managing, and thankfully I was growing the business, and so I was hiring other pelvic floor physical therapists and teaching them and training them my methods, and so they were working on my body, and so it was like I couldn't train for optimal health and performance, but I was or I wasn't choosing to at the time, at least. But I was, when I was in such the thick of it, I at least had the pelvic floor physical therapy to get me up, waking up every single day feeling good in my skin and feeling good in my body, and at least giving me some energy from that pelvic floor physical therapy. So that's the benefit. And that's where I want you to see, like, you use these tools, whether you're living the couch potato chaos mom life, it doesn't have to be couch potato, but like running the kids at the park, and you're, skimping by and just trying to keep up with everybody and get the groceries and get the food on the table. And also maybe you work a little bit. And so, like, it doesn't matter what phase of that you're in, or you're in the full on, I'm working on myself, my routine is the biggest priority, and I am shooting for optimal health and performance, or optimal health and well-being, then you are doing the same thing, right? Like, that's where pelvic floor physical therapy is so beneficial. So I hope that gives you some insight. Other tools that I have used chiropractic medicine. I like going to the chiropractor. I feel like that gives me a little bit of mobility to help me like get even more mobility in my stretching. I tend to be a very tight person, so that has been helpful for me. And also just like from a nervous system balance, I also, have tapped into some dry needling, which we also are going to start doing at our clinic. But I see a guy, at least I see him once a week, just for my optimal health and well-being. And so the chiropractor, the dry needling, I also just the regenerative tools that we have in the clinic. So using EMTT, using Shockwave, I use those probably 4 times a week minimum. Shockwave, I ebb and flow with it. Definitely a couple times a month before my cycle. But if I'm having an injury or fighting something like with this back pain, I've been doing it a couple times a week. EMTT 4 times a week. I love the EMTT. It helps pulse out inflammation. It brings new blood flow to the tissue. It is super soothing. And so it's really good for any pain that you're experiencing. I love doing red light therapy. I sleep a ton better when I do red light therapy. So red light therapy with the collagen production, with the happy juices that it produces. I just think red light therapy is amazing. It also has been good for my back injury. It definitely helps take some of the edge off. I also love sauna, so I will go through phases of using sauna. I'm not a big cold plunger, but that might work for you. Everyone has differences in regards to that. You can check out Stacy Sims and her responses to whether cold therapy is good or bad. It's really in the mix. It's not bad for you. It absolutely has its role, but maybe it's better for men than it is for women, but it's still good for women, but maybe just not at colder temperatures is kind of her take-home message. So it kind of depends on your goals and all that good stuff. But those are some of the health and wellness tips that I absolutely love for not just healing postpartum, not just getting through motherhood, but also for health, optimal performance, and not just for healing back injuries or healing hip injuries or healing ankle injuries. It's all one and the same. So if you got anything from this really chaotic episode, it's that I hope that you see that what you do for your health can be in any phase, and you really should be doing it for your health, because if we don't take care of our health, there will be sickness, there will be injury, and then what we do for those injuries, we would have to be doing anyways. So you kind of just have to keep going. There's no other real option. And also, I don't want it to be depressing, but the same stuff that you start doing after an injury needs to be the same stuff that you continue through whatever phase you're in, whether it's the couch potato phase, whether it's your training phase and you're trying to be as healthy as you can be. So I'm Dr. Allison Feldt. I hope this episode made sense. I am heading to a fasted blood draw, so I absolutely have not had coffee yet. I have not had my food. I have not had my workout. I have not had my steps. Normally, I have all of those things before I even consider speaking to a camera. So we'll just see how this comes out today and go from there. I hope you have a great day. Like and subscribe to us on YouTube. Follow us on Instagram. Follow us on TikTok. We are everywhere, hoping to get this information out so that women can live their absolute best lives and then therefore unlock their creativity and deliver endless support to society and continue to evolve humanity and heal this world so it can be the most epic place. And when women thrive, that's what can happen. Take care.